Hey everyone, it's Lisa here with Hope for SCD. It's time for another video. Today's focus is a clinical trial on mobile technology and an increase in medication adherence and management. So this study is actually for both children and adults, and anybody ages 5 and up can participate. Both genders are acceptable, and you either have to have a diagnosis of any type of sickle cell disease or thalassemia. You need to be on transfusions, chronic transfusions, and have iron overload. And it's happening down at Duke University, which is in North Carolina. The objective for this study is, and I'll just read it and then we'll explain it, is to increase adherence to the medication regime. And the question being posed is, will intensive training and education and daily remote monitoring with provider interaction have a lasting impact on medication management? So what they're looking for here is whether or not they can increase people's usage of iron chelators. So when you have iron overload, you have to take a medicine that there's two options that are currently available. There's one new one that just came out on the scene, but it's not completely available to everybody. So right now, the most common options are an injection. Most people don't want to do the needle, for obvious reasons, or a drink that kind of, to me, reminds me of Metamucil, where you put the powder in and you stir it up in something like orange juice and then you have to drink it, and it tastes really gross, and so a lot of people really struggle to follow that iron overload medication regime. And so what the doctors are looking at here, and I actually think it's a pretty exciting thing, is can they use mobile technology like your smartphones, your iPad, or even logging onto your desktop to increase your medication management. So the doctors have developed this new approach, and they're testing it out with people that are tracked down in North Carolina. And what you have to do, it's in 3 parts. And the first part is for the first 3 months, you're taking a video of yourself just taking a sip of your iron chelation, or of your child drinking the iron chelator and sending it in. And then they also have this medication log app. It sounds like it was kind of unclear in that area whether or not it was an app or some software that they gave you for you to document all of your medications right on your phone or on your iPad, which I thought was really great, because that's definitely not something that I track for Sophia, although I would like to. I just don't really think about it. And if it was on my phone and it was just clicking a box, that would be really great and really easy. So then they get that data every day, and then for the next 6-month period, every month when you come in for your transfusion, a nurse educator comes down and presents some new curriculum that's mobile and technology based as well, just kind of around iron chelation and your transfusions and all different types of things that have to do with medication management and sickle cell thalassemia. And that happens once a month, like with your monthly transfusion for 6 months. And that's it. So this is a really short one because there's not a whole lot of explaining I have to do, because it's not medically complicated. It's just, can mobile technology increase medication management? And I think it would be really exciting to be in this clinical trial, because you get to try something new that's not even out on the market yet, and be a part of a really great study to see if it really does increase adherence. I would suspect that it would, since we're all kind of glued to our smartphones these days, but we'll have to see. Maybe if you participate in the study, you can explain how it was when it's all said and done, and that would be really great. All right, the collaborator is Duke University, and the sponsor is a group called Sickle Incorporated. The contact is Dr. Nirmish Shah, and that's SHAH, which is down below here. His phone number is 919-684-0628, and I left the email down below as well. If you look in the description box underneath the video, it has all the information and the official title. Stay tuned tomorrow when we have another one that's open for both kids and adults. Thanks. Bye.